pregnancy, many changes that occur, physiological and anatomical, for the development of fetus. The main changes are occurring in cardiovascular system, respiratory system, bone, endocrine, gastrointestinal system, hematological system. So today I'll be discussing about the changes that occur in the cardiovascular system. The changes in the cardiovascular system will be thinking in terms of the one, cardiac output, second, heart rate, third, blood pressure. These are the three variables and investigations like echo, ECG that we'll be discussing later. So first we take the cardiac output. The estrogens will produce reabsorption of fluid by the activation of the renin, angiotensin, aldosterone system. So this will increase the plasma volume. That leads on to increase in the what is called preload, that is the venous return to the heart. So the preload increases, the Starling slow, the stroke volume increases. This contributes to increase in the cardiac output. Cardiac output increases by 30 to 50%, and this peaks in third trimester. And as mentioned, it is driven by estrogens. Now we take the heart rate. Heart rate increases usually up to around 100 per minute. Again, we know the stroke volume into heart rate is the cardiac output. So the increase in the heart rate also contributes to increase in the cardiac output. Now we take the blood pressure. The progesterone will produce vasodilation. So progesterone produces vasodilation. So that leads on to decrease in the systemic vascular resistance, around 20% reduction of force. This leads on to a fall in BP of 10 to 15 millimeters of mercury, especially during the first trimester, normalizing by the second trimester. So that is another point to be remembered. Then the growing uterus will compress on the inferior vena cava. So what will happen, especially on the supine position and right lateral position, this will decrease the venous return and plasma volume decrease, or the peripheral, the preload decreases, leads on to decrease in the stroke volume and cardiac output, and can lead on to supine hypotensive syndrome. In addition, the compression of the inferior vena cava will lead on to pedal edema and also increase incidence of varicose veins. Now coming to the anatomical changes occurring as the uterus is enlarging, that can produce a shift to the heart to the left side. So the ECG may show a left axis deviation and mild enlargement in the chambers. So clinical features because of these things, as mentioned, this will lead on to decrease in exercise tolerance, palpitation, supine hypertension, increased incidence of pedal edema, and varicose veins. So today in this session, I have discussed about the major changes that occurs in pregnancy, the cardiovascular system. The changes are maximum during the third trimester, and that is why patients with asymptomatic cardiac disease can become symptomatic, and even normal person can have some symptoms. Hope this was useful. Stay tuned for further videos on maternal changes